Is physical therapy for people that just get injured, or who else would need a physical therapist, Kristin?
Yes, obviously, the obvious answer is injured people need it. We need it for rehabbing that injury, for starting to transition into the real world, and then to continue to get better in the world. Or prehabbing, for that matter, if you're going to have something coming up, if you want to train for something. We have physical therapists, we have personal trainers, and both are very important. The difference between a physical therapist working with you and a personal trainer working with you is the level of education. And we're trained to know exactly what's going on with the body. We can help identify when it's time for you to move, and go see your doctor. Personal trainers are amazing at strengthening and helping people out, and they also know when their limits are of, well, I can't tell you what's going on with your body because that's not their world. Why don't you go over and see your physical therapist and see what's happening there? Now, in the traditional world of PT, you got to go in, you got to see a doctor. You can't pay cash to do it, unfortunately. So those of us who have opted out of the insurance world are offering that to people as more of a, hey, you can come and check in with me and my expertise and see what's happening. Do you need to see more? Do you want to see more? Do you want to just have a few sessions to figure out how to move your body and what to avoid when you go back to your fitness club or golf or tennis or, once again, sitting on the ground with your grandkids?
Kristin, what is the benefit to have physical therapy and Pilates all in one place at Studio U?
Well, Pilates is the tool that we use. Pilates is a movement system that it has 500 plus exercises in it, and it teaches you how to move at your joints and how to program your body starting from the center, moving outward, which is really important. Now, from a physical therapist standpoint, we're able to break down those exercises into something that your body can figure out what it needs to do versus just doing an exercise. I'm going to take it out of the Pilates world for a moment just to give a good example. So a burpee. We all hate burpees. They're horrible. But if you look at what a burpee actually is, it's, can you bring your hands to the ground? Can you step out into a plank position? Can you do a push-up? Can you come back in? Can you stand up? So all of those pieces in that exercise, we can break down into smaller exercises, taking gravity out of the world, taking other joints out of the mix until you can start putting those pieces together. So that's a high level motion that we can break down to low pieces. And then as a physical therapist, we're able to take those little pieces and put them into your body of what you need so we can build the bigger picture, whatever that might be for you. The burpee is just a really easy example because we all hate them. And that's why, because there's so much going on in them. So.
Can anyone see a physical therapist, Kristin? Is there an age limitation with physical therapy?
No, any age, 100%. Unless here we see people from age depending, let's see, I'd say 16 to, well, actually 80 right now. We have had older clients. But yes, we'll see every age group. Because of the Pilates equipment that we use, they're all spring loaded, so we're able to change the load to help us achieve what we want. If people have a hard time in a standing or a sitting position, we can get them lying down. We can get people in lots of positions. If they can't lie down, we can get them sitting. We have equipment to help us support whatever we need to. And the springs are meant to either give assistance or resistance, so your muscles are moving reciprocally and trying to make sure that, if your quad's working, your hamstring is there to support, and vice versa, so agonist, antagonist. And balance. We're looking for balance in your body. So any age group is appropriate, and we're going to work to whatever that age group needs.
How do I know that I should go see a physical therapist? Is it because of pain in a specific area? Or how can you sum it up to know that, yes, I should see a physical therapist?
Start with your doctor if you have a sharp shooting, something that came on suddenly kind of pain. A doctor would be the more appropriate place to start. If you have a nagging, achy, just something that doesn't sit right with you kind of feeling, physical therapy is a great place to start.
Can you sum up an average duration or an average number of visits that a patient might come to a physical therapist for?
Depends on the problem, obviously. What you should know is within the first 3 sessions, you should know that you are feeling a change, some sort of change. If you're not, you need to find and talk to that physical therapist and find something else if you need to, because it might not be right. To go through a course of care, if you're just truly rehabbing an injury, 6 to 8 sessions, you should know you're well on the way, if not better by then, but getting closer. So on average, I'd say 6 to 8 sessions to take care of an injury.
Kristin, what are the advantages to being an out-of-network or a facility, a physical therapy facility like Studio U that does not work with insurance? What are the patient benefits?
You can decide how long you actually want to be there. In the insurance-based world, there's a cap. As soon as you get functional, we're discharging you because we have to. In my world, we can move into the maintenance phase, what insurance would consider maintenance phase. There is no real such thing as maintenance because we're always building, of course. But the maintenance phase is more of, okay, your pain is gone, but you're in this middle world of, I'm not back to everything I want to do. I know that I can't run those 5 miles yet, even though that was my goal. But there's nothing to justify it in the traditional world for insurance to actually pay for it ethically. So in this world, we can continue to get you back to that level and continue progressing your exercises, progressing what we do in here, and get you to that. We also can have you come in just so we can watch your exercises, which is really where our world comes in, is okay, you've left traditional world or insurance space because you feel good, but you're not there. Well, you can come in and we can start to say, nope, you're gonna do this and you're gonna do this, and you now have some onus again to keep doing that program so you don't end up back in that old world with a re-injury.
What do you love about being a physical therapist?
Working with people, getting to know them, and watching their bodies. Bodies are amazing. They move so beautifully. And I like pretty movement, so we like to restore it.
Awesome.
So.